I am a family physician. We have a family practice, so we take care of babies, elderly, full scale of healthcare.
At day one, I work along with Dr. Ptacin, rooming his patients, making sure and assisting him with procedures and calling back with results, and just basically the patient care aspect along with Dr. Ptacin.
We have a very large practice of all ages, and patients are often in and out of the hospital, and so what's happening at home is huge.
When we're choosing home care for a patient, we typically like to work with Lifespan just because they are just so willing to work with us. It's not just calling several places. We know that we can call them and they'll direct us to the right place for the needs of the patient. So it's very easy. It's a one-on-one that we can work together, and we trust the fact that they know what they're doing and they'll help with the patient.
We're counting on the nurses in a home care situation to be our eyes and ears. They're highly trained. They can call us and tell us if they're worried about blood pressure, about symptoms. They can communicate with me. I can then talk to my nurse who can get back with them. So the home care nurses make it easier for me to be on top of the situation at home. With Lifespan, they have the home care services, they have medical equipment, they have hospice. So it makes it easier for me to just deal with one organization. So it makes it easier. I have to be careful to make sure patients are getting optimum care from all these different organizations or parts of Lifespan. But so far, we've been very, very pleased. Patients are so pleased with hospice care. I'm very pleased with the home care, so are the patients. So it's been easier for me to deal with my work, and I believe hospice does, and home care does, and the equipment branches of Lifespan all do very good work. They work well together, and I'm very happy with them.
When you work with, an outsourced agency to help the patient, you want to feel that your patient's being taken care of, that the organization's there, that the communication is there between the patient, the organization, and the office, because we're ultimately responsible for that patient's care. So, when working with Lifespan, we just feel that they call us, they're organized, they're honest, they're caring, they're compassionate, and we work along great side by side. If they have a question, they give our office a call. For everything, they'll report falls for the patient, even if it's just something simple, so we know exactly what's going on with that patient. If they have a question in terms of their med list, they call. We compare our med list to what they have. If there's any discrepancy in that, we'll fax them a new med list. So the organization and caring of Lifespan to our office is great.
I don't think I could use one word to describe the home care Lifespan nurses. I think of them as dedicated, educated, thorough, caring. I know some of them personally from attending classes with them, and they're good people. It'd be hard to pick one word, but I'd say dedicated, caring, thorough.
Lifespan, and when I'm basically describing Lifespan in one word, I just think great. I think they're great to work for, they're great for the patients, and the patients really can rely on them.